It is common during cold seasons to find patients complaining that they have swollen tonsils. Today, KAREEM'S clinic looks at swollen tonsils, a condition known as tonsillitis, and also we are going to look at how the tonsils get swollen and why. The first thing that I want us to look at is, what are these tonsils? Tonsils are found at the back of the mouth and on top of the throat. Now, these tonsils are two, on the right side and on the left side, and they are fleshy. If you dig deeper, tonsils form part and parcel of the immunity of every human. They act as filters. They trap germs that otherwise enter your airways and cause infections. Now, when they trap germs and they trap disease-causing pathogens, that is just enough to tell us why they swell. Instead of allowing the germs pass, they trap. So it is these germs that create an infection in them. Tonsils are very important, and that is why it is always advised most of the time that don't remove them if the situation is not dire. If you have a problem with the tonsils and a surgery is supposed to be done, if there is no other option, that is well and good. But if there is an option for treatment, kindly go for that option for treatment away from a surgery, because the tonsils make antibodies to fight infections in our bodies. So, sometimes these tonsils get overwhelmed by bacteria and viruses. It is these bacteria and viruses that make them swollen and inflamed. When they are swollen and inflamed, that's when we begin complaining that we feel pain just around our necks, two swollen, protruding ball-like substances on either side of the lower chin. So when these tonsils swell, then we call that situation tonsillitis. Now, tonsillitis can be acute. It can also be recurrent, so that after every 2 months or after every month you have them. And tonsillitis can also be very chronic, especially when it is long term. You know, we have the long term tonsils. They swell and they swell for long. So acute tonsillitis would always last 3 to 4 days, but they can still go up to 2 weeks. And then recurrent will always recur. After every 1 month or 2 months, it comes back. And chronic is that long term. What are symptoms of tonsillitis? The main symptoms of tonsillitis are swollen tonsils. That is always the first one. If you have swollen tonsils, sometimes these tonsils are too swollen for you to breathe. The throat becomes painful and tender. Sometimes if you look at them from afar, the swellings, you realize they are red. So those are symptoms of tonsillitis. Also, you will experience headache, and this headache would extend up to a point where you begin feeling pain in your ears, both ears or one ear, depending on, are the tonsils on both sides swollen, or just one side, because tonsillitis can also occur on one side, one tonsil, and sometimes it occurs on both sides. So you will also have trouble swallowing. If swallowing even saliva becomes a problem, then chances are you have tonsillitis. There is always a painful blister in your throat. That happens especially with the chronic tonsillitis. Stiff neck is another thing. You complain, a lot of us complain, of course, like in Africans, we complain, oh, I didn't sleep well. It is because of the sleep that my neck is stiff. Sometimes it's not the position of the sleeping position that induced the neck pain. Sometimes it's just tonsillitis, but because we are not aware, and I'm making us aware, tonsillitis can also lead to that. So if you have a stiff neck and you have pain in your tonsils, then you will remember that tonsillitis could be the cause. A scratchy voice. When you talk, when you speak, your voice becomes scratchy, and then also you will always clear your throat. When your voice is scratchy, you find yourself clearing your throat, a sign that the pain could be spreading. But of course, you can always clear your throat also if you have mucus in your throat. So that is an overlapping sign. Fever and chills is another thing. You'll always feel fever. You always have chills, loss of appetite, and that is very important. So these are tonsils in adults. However, in children, it becomes a little bit different. Children usually have upset in their stomach. They have stomach upset. So when a young child or an infant, when you realize the child has stomach upset, they are vomiting and they don't want to swallow, and that is the point that you now realize a child has tonsils. You try give them whatever they usually eat, what they used to, what they swallow so easily, but again they spit it out, and you realize they don't want to swallow it. And when they see food and they see a sign of swallowing, they cry. So if you realize your child does not want to swallow and they are constantly complaining of stomach upset, the maternal instinct in a mother will always tell the mother that the child has a stomach upset. And all mothers would agree with me on that when your child has a stomach upset, colic, or just a normal stomach upset, you will always know. There is that maternal instinct in a mother that will always tell the mother, no, this child has stomach upset. When the child vomits also, and also stomach pain, that would mean the child has tonsillitis. And the surest confirmation in all signs and symptoms is when the child doesn't want to swallow. When the child always rejects swallowing, that is when you say that is tonsillitis. So don't look at the child vomiting and then you begin thinking it's tonsillitis. No. You have to make sure that the child doesn't want to swallow, and a sign of pain in their throats. A mother can always know that. So, tonsillitis can be caused by viral infections or by bacterial infections, but it is common. The common bacteria that causes tonsillitis is known as streptococcus bacteria. So this streptococcus bacteria is always, it actually also causes what we call the strep throat. And those who can relate, there is this lozenge. It is part of the lozenges called strepsils. You know, the name came from streptococcus. So there are very many diseases that if you have, they can always show themselves or exhibit themselves as tonsillitis. In other words, the whole of these tonsillitis that we have learned can always come as a single symptom of a main disease as well. If you have herpes simplex virus, which causes herpes, if we have influenza virus, it can also lead to tonsillitis. So usually we say stop exposing children to germs. If you expose children to germs, they may get tonsillitis. So when you go for testing, you can always do a test. You can do a blood test that will show you which bacteria specifically is there. You can always do a throat swab where your doctor will now take the saliva, test the saliva and the cells from your throat for the strep bacteria. So if there are many complications that you can have with tonsillitis. Tonsillitis can always cause obstructive sleep apnea. So when you are sleeping, you have problems in breathing. So breathing that can stop while you sleep. So it stops, and when you sleep, it starts and stops. So it is that obstructive. So there are home remedies that we can use. Of course, the main antibiotics for this should be, you can have a one-time injection or pills. So there are many antibiotics that your doctors can always prescribe for you. You can have injections, as I've said, and probably you will feel better from the third day of injection or the third day of using your orals. But we also have home remedies, as I'd said. We have, you get warm water, get boil water, put salt in it, let it warm with that salt. Warming to mean it was hot and now it's warming a little bit. It's becoming colder a little bit. So when it reaches that temperature that can't hurt you, you can always gargle it. Make sure you gargle it. It gets so deep next to the throat and then you spit it out. Of course, salty water is not harmful when it gets through into your digestive system. So when you find yourself swallowing it again, there is no problem. But now the main aim is you to gargle. Make sure it touches deeper into the throat. Then you bring it back. You bring it back. Also, you drink warm water. Always try to drink warm water. Avoid cold water because cold water will bring pain to your throat. If you have tonsillitis, get lots of rest. Rest, take your time, sleep, and everything will be okay. If you have pain, and as I'd said this before, there is one painkiller that usually helps in killing pain at the same time dealing with inflammation. That is brufen. So brufen, or what we call acetaminophen, can always help. The fen group can always help in killing the pain and helping in the inflammation. You can always use also lozenges, the strepsils, the Vicks King, or is it King or King or something next to that? King or King, strepsils, There are those that are also made of honey. But again, avoid sugar. Avoid sugar because the sugar will irritate your throat even more. Then you will have to clear your throat and the pain will be so much. Avoid ice cream. Avoid smooth foods. So if tonsillitis gets worse, it becomes chronic, an operation or a surgery will be done to remove them. If you want to prevent tonsillitis, always take care of your cleanliness. Make sure you are clean, good hygiene. Wash your hands most often. If you want to eat, if you want to handle a baby, make sure your hands are clean. Wash your hands because probably it is those germs in your hands that you could use to touch the kid's body, and the kid has got very weak immunity. That means the immunity is not as strong as that of an adult. So the kid is prone to diseases or to infections. So wash your hands before you handle a child. Also wash your hands before you eat. Stop sharing food. Stop sharing drinks. When you have tonsillitis, for instance, do not share food, do not share drinks, and don't also share personal items like toothbrush with anyone. Because when you're brushing your teeth, it is within the mouth, the throat, that we have the bacteria that cause tonsillitis. So these bacteria will attach themselves on the toothbrush. When you share with somebody else, chances are you're going to transmit this to that other person. Then also make sure you stay away from people who have tonsillitis. No discrimination kind of, but when somebody has tonsillitis, of course they can infect you, So try to give yourself some distance. Make sure they are always resting. So today, I want us to note that tonsillitis is common during cold times, during cold season. So we need to take good care of ourselves during cold seasons, and also take good care of our children during cold seasons so that they do not suffer tonsillitis. So today, that is all we had. In our next videos, we look at more other diseases, and as I've always said, let us learn these diseases or infections so that when we see symptoms, we can always make haste and make sure we are safe. Always approach or go to a health facility when you realize these symptoms that I'm mentioning. Over-the-counter drugs are always very helpful as well, and you can always use them short term before you get to the health facility. That is the time we've had today. If you find such videos helpful, kindly consider subscribing. Till next time, this is KAREEM'S Clinic.